9 months ago, my mom was in a coma in a Portuguese public hospital. She had been there for almost 2 hours before anyone touched her. Not examined, treated, just placed in a bed. I was standing there watching her and I could not get anyone to help. I spoke to staff. I was ignored several times. I raised my voice. Security threatened to call the police. In the middle of all of that, one of the first responders came quietly to my side and said softly, under his breath, "I know how you feel. Do something, raise your voice again, bring attention to her, but do not take her out of here. She is too bad to leave." So we stayed, until a new doctor came on shift with a completely different energy and finally looked at my mother like a human being. She spent a month in that hospital, 7 days in a coma. When she woke up, things in her leg had gone wrong. The doctors wanted to amputate both legs from the femur down. She refused to sign the consent forms. I transferred her to a private hospital in Lisbon. They gave a different diagnosis. They amputated her toes. The rest stayed. She is walking today. I am not telling you this to scare you. I am not telling you this to attack the Portuguese healthcare system. The doctors and nurses in that public hospital were working through a strike, pulling double shifts, exhausted, dealing with more patients than any system was designed to handle. I understand why it happened. I do not blame them. I am telling you this because most people moving to Portugal assume that free healthcare means covered. And before you make that assumption, you need to understand what free actually means in practice. Portugal has a public healthcare system called the SNS. That stands for Serviço Nacional de Saúde, which is just the National Health Service. It is one of the things people point to when they talk about why Portugal is a good place to live. Universal access, low cost, available to legal residents. And that is all true. Here is how it works in practice. Once you have legal residency, you can register at your local health center and get what is called an utente number. That is your health user number, and it is the key to accessing everything in the public system. Without it, you are on the outside looking in. With it, you have access to public health centers, public hospitals, and subsidized prescriptions. As of 2026, the costs are lower than most people expect. Consultations at a health center are free. Emergency visits are also free, but only if you call the SNS 24 line first and get a referral before going in. That number is 808-24-2424. If you walk into an emergency room without a referral and you are not hospitalized, you pay somewhere between 14 and 18 euros. The system has a way in. You just need to know what it is before you need it. For routine care, the system works. Prescriptions are subsidized, sometimes significantly. Checkups, basic consultations, repeat prescriptions. The SNS will handle all of that. Slowly, but it will handle it. The problem is not routine care. The problem is everything else. Portugal has a shortage of doctors and nurses that has been building for years. The system was not designed for the volume it now serves. When it is under pressure, and it is almost always under pressure, the gaps become visible. As of early 2026, over 1 million residents in Portugal are waiting for specialist consultations. More than 264,000 are queued for surgery. Those are not estimates. Those are official numbers. I know someone personally who has been waiting 2 years for knee surgery. Another person I know has been waiting almost a year for a procedure to remove a benign tumor from her face. Almost a year. That is the reality of the public system at its limits. It will keep you alive in most circumstances. It will not always keep you comfortable, seen quickly, or treated with the attention you need when the wards are full and the staff are exhausted. Free in Portugal means free at the point of use. It does not mean immediate, it does not mean guaranteed attention, and it does not mean the same standard of care regardless of how busy the system is on the day you arrive. When my mother arrived at that public hospital, she was not examined in almost 2 hours. A woman who would later go into a coma was placed in a bed and left. There were more people than the system could handle that day, and the staff were running on empty. I tried to take her to a private hospital before we even got there, but the ambulance driver is legally required to take patients to the nearest public hospital, so we had no choice. When I realized what was happening inside, I was ready to carry her out myself and put her in an Uber. A first responder approached me and advised not to do so because of how severe the situation was, as she was too sick to move without proper support. The honest question to ask yourself before you move to Portugal is not whether the public system exists. it does. The question is whether you are comfortable relying on it when something serious happens. When you are not a routine case. When the wards are full. When there are strikes. If the answer is yes, register with the SNS, get your user number, and use it for what it does well. If the answer is no, or even maybe, then insurance is not a luxury. It is a budget line. To work out what that budget line actually looks like for your specific situation, your family size, your lifestyle, your income, I built a free cost estimator that gives you a realistic monthly figure for living in Portugal in a few clicks. Link is in the description. When I transferred my mother to a private hospital, the difference was immediate. Not just in the diagnosis, though that difference saved her legs, in the attention, in the communication, in the feeling that someone was actually looking at her case rather than managing a queue. I have been using private healthcare in Portugal for years. CUF and Hospital da Luz are the two main private hospital networks that English-speaking expats typically use. Both have English-speaking staff. Both have shorter waiting times than the public system. Both operate at a standard that most people coming from the US, UK, Canada, or Australia will recognize. When I started using private care around 2022, I was paying around €15 for a consultation, with insurance. Today, at Hospital da Luz, I pay around €20 per visit, also with insurance. My monthly insurance premium is around €70. €70 a month. That is what peace of mind costs in Portugal. It is nothing compared to the cost of being caught in the public system on the wrong day without a fallback. The other thing worth knowing is that most Portuguese visas, the D7, the Digital Nomad visa, and others, require proof of health insurance as part of the application. So for many of you watching this, insurance is not optional anyway. It is a visa requirement. For health and travel insurance that covers Portugal and works across 180+ countries, I have a recommendation in the description. It is the option I point people to when they ask. Check the link in the description. And if you want vetted recommendations for English-speaking doctors, private clinics, and healthcare contacts across Portugal, all in one place, I keep an updated resource guide that covers that and more. 100+ vetted services across 15+ sections. Link is also in the description. Here's the practical answer. Register with the SNS. Get your utente number. It takes time and some paperwork, but it is worth having. Use it for prescriptions, routine checkups, and anything non-urgent. The system works for those things. Get private insurance. Not because the public system is bad, because the public system is human. It has limits. It has bad days. It has strikes. It has wards that fill up faster than they can empty. Find an English-speaking private doctor before you need one. Not after, before. The resource guide in the description has vetted contacts. Use them while things are calm so you know exactly where to go when they are not. And if you are navigating visa requirements, proof of insurance documentation, or trying to figure out what level of coverage you actually need for your specific situation, that is exactly what the Clarity Call is for. One conversation, your specific case, a straight answer. Link is in the description. The Portuguese healthcare system will probably never cost you what it almost cost my mother, but probably is not a plan. Insurance is. My mother is walking. That is the ending this story deserved, and I am grateful for it every day. But she is walking because I transferred her. Because a private hospital gave her a different diagnosis. Because the decision was made in time. If you are moving to Portugal, if you are already here, if you are planning to bring family, understand what the system can and cannot do before you need it to do something it cannot. Register with the SNS. Get insurance. Find your doctor before you need one. If you have questions about your specific situation, my email is in the description. Send me a message. And if you found this video useful, watch this one next. Click now and I'll see you there. Ciao.